The rollout of the Covid-19 vaccine is not going as planned in Europe. Vaccines are being held up due to a cut in deliveries. AstraZeneca says fewer doses of its vaccine will be ready for the bloc's planned rollout. To speak on this, Professor Alex van den Heever, Wits Specialist in Health Economics and Finance, joins me now. As always, thanks for joining us, Prof. Great to speak to you. So AstraZeneca has told European Union officials that due to unspecified manufacturing issues, they'll not be able to deliver as many doses of the vaccine as originally hoped, and that comes shortly after Pfizer also announced it will cut deliveries to the European bloc. Do we know what's sitting behind all of this?
I don't think we do, but one can expect that there will be a lot of technical hitches in the sort of the ramp up of vaccines at this point. We'll also, one can expect that there's quite a big demand on the people that are manufacturing at this point, and they're basically trying to accommodate everybody that's put orders in and to address the sort of the most urgent needs. But there's also been a fire at the plant in the Serum Institute plant in India. And although I think they've indicated that it didn't have an impact on the production of the vaccine, it may certainly have had an impact, but we don't know.
Many European countries have not yet authorized the AstraZeneca vaccine. What's the delay, and should we be worrying in South Africa that we've already got 1.5 million doses secured from the India Serum Institute to be delivered hopefully by the end of this month, and we're going to go ahead and administer those, despite the fact that in Europe certain countries are yet to give the go-ahead?
Yeah, well, the United Kingdom has approved the vaccine, and I think that I think the European Union, European regulator will approve it as well. I don't think that will be a serious hitch, but I think that in South Africa, we probably should have tried to acquire more of the AstraZeneca vaccine up front, so we only have 1.5 million doses. We're not entirely sure about how it's going to be distributed when it arrives, because there are no plans that have been made public. But I think that it is better that we have this coming through. Instead of 1.5 million, we should, at the very minimum, have 3 million doses available for the rollout, which would at least cover phase 1 and part of phase 2. But I think it's better that we have that in the bag than that we don't.
If wealthier European countries cannot secure sufficient doses from AstraZeneca to meet their time requirements, or perhaps from Pfizer directly, is there any risk of them using their buying power in trying to secure doses intended for poorer or developing countries?
I don't think so, because a lot of their commitments at the moment are in terms of contracts that have already been entered into. So it would require a variation of the contract. So I don't think that buying power has any implication. I think that what we're experiencing now is the period in which there will be a supply constraint throughout the globe. I would expect that the supply constraint will diminish as the year progresses, because not only will more vaccines than the current kind of big four be approved, but a lot more vaccines are going to come online, and probably our production, the global production, will begin to meet demand quite effectively toward the end of the year. The crisis at this point is that Europe wants to attenuate the current surge in Europe, and South Africa also wants to hit the current surge, and it also wants to make sure that it is prepared for the winter surge. So I think that it is everybody really wants a vaccine right now rather than in November.
One can understand that, but if sufficient doses cannot be secured timeously, is that likely to result in more rounds of lockdowns in Europe as countries experience perhaps third and even fourth waves?
Yes, if they don't get access, essentially it's the same for every country, and it's quite clear that countries that experience severe winters face great difficulties in being able to contain the surge without very severe restrictions, which is economically damaging. South Africa can't afford the kind of severe lockdowns that Europe can, but what we're actually seeing at the moment is that we are able to impact on the epidemic with a sort of a narrower set of restrictions. But when we hit winter, it might be more difficult. But yeah, everybody's going to basically have to use non-pharmaceutical interventions to try and contain it and to contain the impact on the hospital system. And it will have an impact on the economy during 2021.
Do we have the capacity here in South Africa to withstand a prolonged period before vaccine-induced immunity takes hold and we see a drastic reduction in cases? I mean, you're a professor not only of health and economics and finance, but I mean, so what is the financial impact if we cannot control the numbers before winter?
I think that so at the moment it's clear that the last set of restrictions, these level 3 restrictions, had an impact on the super spreading events. And there's a sort of a single period between the sort of the 11th and the 13th of January in which across the country there's a decline in new cases. That's, I think, quite important. And we have not had as drastic a lockdown or a set of restrictions as Europe. So I think that we do have to avoid it. We will not be able to implement anything more severe than our level 3 restrictions. We can't afford it in South Africa, and we can barely afford the current level 3 lockdown because the impact on the alcohol industry, for instance, is actually devastating. And although the alcohol industry imposes some social harm on the country, it also imposes social benefits through employment for many, many families. So we have to look at that. And they're also taxpayers, so they maintain the sustainability of government finances. So when we shut down any part of the economy, it doesn't just affect that business, it affects government as well. So we basically are at the end of our runway on economic impact. Europe can get through this, even with economic shutdowns. They can stimulate their way out of their crises. They can incur greater deficits. South Africa can't. So we really do have to prioritize getting at least the high priority groups vaccinated as soon as possible. That can at least eliminate the severeness of illness, even if we experience a third surge.
Thank you very much. As always, Professor Alex van den Heever. He is a Wits specialist in health economics and finance.